You're listening to the Two Sleuth Podcast, all about the business of dentistry, hosted by yours truly, Greg Essenmacher, a fixed full arch dental expert and founder of G&A Consult, speaking with industry leaders on the dental landscape from their perspective. Ladies and gentlemen, boys and girls, I am super excited today. We're going to talk arches. That's right, on Full Arch, on the Two Sleuth Podcast. I have none other than Dr. Raj. That's right, my friend Abhishek has come on the show from Areo Dental. If you haven't heard about him, well, you're going to hear about him today. So, my friend Abhishek, will you please introduce yourself to my listening audience? Who the heck are you if they haven't heard about you?
Hey, listen, I like to identify myself as a dentist first and then a co-CEO next. I mean, obviously I'm a co-CEO because my partner Anushka is the other half of this component of the business, partners in life and in business. I've been in business as a dentist for 13 years now because I'm also an international dentist who came as an immigrant in 2011, went to NYU, and long story short, we opened our first practice in 2016 together when Anushka and I were only engaged to each other, slightly risky in hindsight, but eventually we did one a year and kind of grew our practices, took distressed practices and grew them to, a couple $1 million practices. And we've done this 7 times. And now it's like a different level of unlock. I'm trying to take these $2 million practices to 4. And I'm excited to share some of the learns that I've had along the way. But thank you so much for having me, though.
Yeah, absolutely. I'm kind of curious though, because you said it was a little risky. Are you referring to opening a practice every year or to the fiance that became your wife? My listening audience just wants to know.
It's the latter.
Okay, good. I just want to get that out of the way. So when she listens to the program, whether or not you're going to be sleeping like out in the doghouse with what was your pup's name again?
Pumpkin.
Pumpkin. Okay. So we don't know if we're going to get Pumpkin into the show. We probably will into the YouTube and flash her like during the commercial break. I think that may be where we'll get Pumpkin into the show. So just so you know, we're probably going to try to figure out how to get Pumpkin into the show, your little Yorkie. So
no, thank you.
amazing and adorable. Well, you know that the Two Sleuth is all about, well, at least G&A Consult, we're all about full arch dentistry. And so I'm super excited to hear about, tell me about your practices. Tell me about the very first one. How did you get involved in full arch dentistry, fixed full arch dentistry, this teeth in a day thing? Was it something, a passion from the very beginning? Was it something you brought here to the States before you got to NYU? How did you get exposed to this great and wonderful treatment for patients to be able to get these brand new smiles?
Yeah, great question. No, honestly, I did not bring it with me. I think when I came to America, I was like an average dentist at best, right? Like my experiences were fairly limited in India, so good education, but it wasn't enough to like get me thriving in America. It's really the unlock came probably in NYU when I saw some heavy hitting dentists. Like I remember talking to a dentist who was doing, I kid you not, $8 million a year doing only implant dentistry, right? I was like, how the heck do you even do that? And that was like my first foray into implant dentistry and what was possible. Came out and I worked with somebody that I'd actually worked as a dental assistant for like 6 months. He offered me my first associateship in Chicago. I followed my wife, Anushka, girlfriend back then, because she's a dentist and she was also practicing here. And I worked with my previous boss for about a year, and then I realized that I had an itch to go do surgical stuff. I always had that itch. And he said, yeah, you can go learn implants if you want, but like, don't count on me to train you because I have never done it. And he had like 4 associates. It was a $4 million practice, bread and butter dentistry, really cranking at a high level, high profit margins. But he's like, if you come to me for any help with implant dentistry, like, I don't know. And I don't even know how to fix it. So make sure you learn your shit, right? That's basically. So I was like, okay. And then I jump in first year in practice and I go take an implant course. I go to the Dominican Republic and I come back and I crank out like 10 implants in like the first 2 months. He's like, holy shit, like you're really doing this. And then 2 months later, I tell him, hey, I'm actually leaving to go back, like start my own practice. He's like, you freaking, like, he was so mad, but he was also happy for me that I placed all these implants and I was leaving. That's kind of how I got started. And then came back, and in our first practice, I probably started doing. Most people ask me like, how many implants do in your first year or second year? And they'll say like, I did 10 implants. I'm like, in a month. Then they go, no, in the entire year. I'm like, whoa. Okay. So I started cranking out like 5 to 10 a month and slowly like 20 to 25 a month. And there came a time where I was like, okay, I got to get into more full arch stuff. So I had some great mentors along the way. I took a lot more CE, pretty aggressive CE. It allowed me to come and do same day, but not just do implants, but do same day conversions, do the lab pickups, do the denture conversions, and put people in teeth in one day. So
And you were doing those yourself, the conversions and everything, or did you have somebody doing those with you?
I did my first 2 cases by myself, big mistake. I was like, "I'm never gonna do that again." Like, I was in their mouths for, like, 6 hours, outside for another 4, and then I got smart and, started bringing a lab technician in.
Yeah, you learn that pretty quickly that, those conversions aren't as easy as it looks like on YouTube videos, right? Like I'm gonna bring somebody in to help with that. Well, and I love that you're talking about like the amount of implants, right? Because you'll make some people jealous that really struggle in that first year to do 10 to 20 the entire year. And so I'm curious in the beginning, what was that secret sauce where you were doing that many early on? How were you getting that many patients in the door? Like direct to consumer marketing had to be a part of it. So what was it that your secret was to be able to getting those patients in the door when others will struggle? I mean, you're talking probably 2017, 2018 timeframe. Do I have that about right?
2016, 2017.
2016. Okay.
Yeah. Um, Really good question. I've never actually externally gone out and marketed for dental implants until a couple years ago. Right? It was always through conversion at the practice level. I just got really good at because I had a pretty nice patient base. We had a couple thousand active patients. There was needs in there, and I didn't put a dime or a dollar into marketing for like the longest time. And just got like really good at closing the sales funnel, right? It's like the 10-3-1 thing that you do. Every 10 leads, you get three. I was probably closing at a higher level than that. Every 10 leads that called us, we were probably bringing in 3 to 4, and I was probably closing like 60-70% of those leads. Just got really good. I've always been good at sales, even from like India. Like I've done other stuff. So I've always been like good at converting people and talking them through and educating. When you teach somebody something new, right? People say yes to you. That was really my focus. And then I started scaling myself down as I recruited more associates, right? We brought on like 6 or 7 associates in 2023, 2022, 6 or 7 in 2023, and another 5 or 6 last year, right? That really allowed me to
Last pot.
yeah, yeah. That really allowed me to take a step back and do just one day of implant dentistry, but still do like a couple arches a day. So it's probably doing 8 to 10 arches last year, but I recently just clinically retired like a month ago. Because
Congratulations. Or I'm sorry, whichever way you want to look at it.
it's a congratulations, I'm good. I felt like I hit a certain peak. I was doing the 2.5 million a year by myself. When I scaled back to a day, I was still doing 1.2 million on one day a week. I was like, you know what? I've reached my wherever I wanted to reach as a dentist. It's time to grow the business. So that's kind of what my wife and I are up to now.
Hey there, it's Greg Essenmacher, host of the Two Sleuth podcast and founder of G&A Consult. At G&A, we specialize in transforming full arch dental practices, teaching, coaching, and training teams to deliver an exceptional patient experience, from that first call to delivering final smiles. Whether you're a practice owner, a DSO executive, or a regional leader looking to expand your full arch program, boost same-store sales, or unlock the true profitability of full arch cases, we've got you covered. Ready to see how full arch can elevate your practice? Visit the show page or book a discovery call today. Let's turn your potential into results. Nice. And so talk to me about some of that challenge of bringing on associates and being able to transfer that knowledge and getting them to level up skill. Because it sounds like what I'm hearing, right, for playing charades, sounds like, as I tug my ear, sounds like you have a natural ability for skills in sales. And what we do at G&A Consult is because there's all different natural skills level, right? And being able to make an emotional connection with patients and being able to have empathy for them and being able to walk them through a process. And, with your 60% close rate, which amazing, right? And you understand the 10-3-1, all those pieces. But some people have that innate ability, and some need to be taught that ability of like, here's where you can do better. What are some of those pieces? Because I mean, I could talk about what we do at GNA Consult. And for me, I don't even do a lot of those trainings anymore. I work more like one-to-one with our elite and accelerator clients on like mindset training, right? The abundance mindset, and how can you be better at the top to trickle down to your team? Because I have a big enough team now where those that were actually treatment coordinators train the treatment coordinators, and those that actually converted on the phones for direct to consumer marketing are the ones training on the phones. And the person who actually scaled a group from 5 to 36 locations in 22 months in operations is the person handling operations, right? Specialize in what you can specialize in. So give me a few of those pieces of what you're seeing, noticing of some of the challenges or some of the skills that you're doing to be able to upskill your associates to be able to transfer what I would say is your natural ability in sales for those that need some coaching and guidance to level up in those pieces in that patient experience for conversions.
Ooh, that's a loaded question. Really good one.
It is. I asked those loaded questions. Welcome to the Two Sleuth.
Yeah, no, thank you. Thank you. It's been so welcome here. This is awesome. This is good stuff. Um, okay, there's two parts to this, right? Number one, how do you transfer sales skills being a dentist who can do it at a high level to now you have to transfer? Those are two completely different skill sets, right? Like for me to be able to go do it on a patient because I just knew like what type of things to say, get their propelling forces, what moves them to take action, all that good stuff. To like, how do you take that and transfer to like a new grad or somebody out 2 years? The answer is it's really freaking hard, right? Honestly, a lot of scripting, right? That's what worked for us, right? Lots of scripting. Here's how you walk into the room. To here's the first 2 minutes of how you're going to spend your time talking to the patient. It doesn't involve dentistry at all, right? So lots of that scripting. My wife is a process person, so she was really able to help me like put these scripts together. And then together we were able to go take that to our associate dentists, pull them out of the practices. We do sales trainings in our practices. Once a quarter, we bring like pretty much all
So
of that.
critically important for sure.
Yeah. So we did that, right? That gave us a lot of alignment. But the honest truth is not every dentist should be doing implant dentistry, right? That's the second piece of this. We probably handpicked like 4 of the 18 doctors we have to be able to go and do that, right? Because again, this with implants, a lot of people don't realize they're like, oh, implants, it sounds fancy, but there's so many complications you have to deal with that if you aren't up for it, it can make your life pretty miserable. You can have a lawsuit or it can lead to a loss of license if you aren't on top of it, right? And I think so many of my like new grad hires come in saying, when can I do implants? I'm like, you're not touching implants for the next 3 years because I need you to learn to walk before you learn to run, right? I think those are two different pieces, lots of real conversations with dentists. And usually for us, it's the doctors who've been with us at least 3 years that we then start to take them on an implant journey. And that's not every doctor either. It's like they have to have a high level of surgical skill, that already communicating, that already producing $1 million. Because you and I both know, Greg, that for a dentist to get to $1 million, they must be doing something right. Their communication must be good. And those are the really good communication folks are the ones that should probably be going and doing something like this too.
Well, and they're invested, right? They're invested in the process of the small cases. So that means they're going to be invested as they move along in the journey. I love to hear that. And one of the things, and you touched upon it, right, with the sales training, and this is what we know to be true as well in the patient experience. And I speak on this often. You know, a couple of weeks ago, I was invited by one of the DSOs. I don't know if they're emerging or whatever, where they land, right? They have about 100 locations. And I was asked to do case acceptance, 3 breakout sessions for their doctor's summit. And one of the pieces that I share in that, right, the patient experience is what leads to case acceptance. Team development is what leads to patient experience. And in that, I framed it and talked about the fact of poise. Nonverbal communication is everything. And so I asked everyone in each of those sessions to raise their hand and say, how many of you have actually recorded yourself doing a large case presentation? The small percentage that raised their hand was shocking. And I said, look, it may be alarming to watch yourself, but you all have a tell. And that's why in Las Vegas, you're the fish at the table if you don't know who it is. You might as well just put your chips in the table, like at a real poker table, right? We're talking about like you go into the poker room, you buy so many chips, like, you got the real cards in front of you. And that's why I don't play poker, right? Because like I get excited, my eyes get excited. I have a tell, I know what my tell is. But it is so critically important to be able to watch what your tell is, especially in big cases, because if you don't believe it in what you're showing, the patients will never believe it either. And that's what you're talking about of the building and growing into the believability piece. And you talked about it with the way that you walk into the room, the way that you position. Are you sitting across from the patient? Or are you sitting next to the patient when you're presenting this? Right? These little pieces, it's the words you use because they matter. It's the body positioning. It's the and. And it's all the little pieces that add up to higher case acceptance with the large cases. And that's what we teach, coach, and train at GNA Consult. So you're hitting on all of these hot buttons that I love. And so this is fascinating. It's like, oh my gosh, I'm talking to like a clinician who actually gets it, obviously, or else you wouldn't be where you are today. And that's why I'd asked the question initially, because you talked about how many associates you'd onboarded and what I made the assumption, and that's on me, right? Because when you assume, we know what it makes you and me, right? So I was adding in there that I was thinking just in full arch, but what you're talking about is full scope of dentistry, some of them into the general dentistry, and some of those that actually are on their implant journey side. So tell me a little bit about the growth of your group there at Areo, because I'm curious to hear what that looks like. And you started out by saying some of the learnings, and I call them learning opportunities, not mistakes. Mistakes are what we don't learn from. So talk to my listening audience a little bit about some of those learning opportunities. So those that are listening and maybe have hit a glass ceiling are doing 2 to 3 a month, or maybe they have the violent fluctuations and are averaging the 4 to 7, which means they're doing 8 one month and 1 the next, and they can't really find that balance and they can't figure out why. So maybe some of those learning opportunities that they're trying to go through in order to figure out where they can find that trajectory, the overall trajectory and growth that you're experiencing there at Areo.
Yeah, it's a really good question. And you hit the nail on the head with all of those things, right? One of the first things that comes to my mind is when how are you answering phones, right? Like that's the number when you talked about phone scripting. How are you answering phones? How many patients, how many leads are actually converting to patients? And how many of those patients are actually going to closes, right? I think you have to be obsessively data driven. I think that's my number one thing. You have to like look at the data. Number two is sorry, Pumpkin keeps crying. Pumpkin, stop. Um,
We knew Pumpkin was going to make the show. It's quite all right.
that so the second piece to that though is when you get what I was talking to you earlier about a lot of doctors do the mistake of going and putting in a lot of money into marketing without having their sales funnel fixed, right? Like their phones aren't being answered, they're answering, they aren't doing a good job. Sometimes people are scripting this at a really high level. I know friends who are like, if you call their front office, they're like good because they follow a script, but that's not enough. You have to like teach people to care, right? Like you can miss signs. Like I'll give you an example. I had one of my treatment coordinators answer a call. I just listened to a random call like last couple weeks ago. She checked every box and she was basically because she was following a script, right? But she didn't close on that patient. She didn't convert that patient. And then she was like frustrated. When we listened, I said, "Hey, look, you checked every box, but life is not a script, right? You didn't show the patient you care because he said like I don't have teeth. You didn't actually say like you didn't talk to him like this was your mother or father and say, "We're going to help you. We're going to take care of you here." Right? You just tried to close and said, "Tomorrow you can get in tomorrow and we're going to give you a new set of teeth." That is not good enough, right? And that was like a really cool moment where I was able to put my finger on it and say like you need to care first. You need to teach your team to care. And only then can you start to do like 5 to 10 to 15 implants or whatever that your goal is. Otherwise, you're going to struggle. And I think the people need to know why it's important and the kind of impact you're making when you get people in through the door. I think a lot of practices don't get that right, in my opinion.
The two things come to mind. I agree with you 100%. And it's the why behind the what. Patients don't come in for the what, the product. They come in for the why, the motivation. Why now? Why are they going to move forward today with you rather than the guy or gal down the street or the big box store that's down the street?
Right.
1,000%. And so it's our role as leaders, as consultants, as coaches of helping our team members to get to their why. Why are you doing what you're doing in order to express that through what they do? And the second point you're talking about, so we say scripts don't work, but formulas do. It's similar, right? We give them the framework to be able to speak, but have their natural personality come out because they have to express empathy and care as if it is a family member or somebody. I don't like to say family members because for me, maybe they don't like their mom or dad, but a family member that they actually do like. So somebody that they care about. So yeah, and we like to say that it's a fun little play on words, but it's true. And that's why we talk about empathy, assurance, right? Answer, right? Acknowledge what they've said on the phone, answer their questions if they ask and ask another question, because it's so limited what patients will call and ask. Most of the time, all they know how to ask is, how much do you accept my insurance? That's not really what they want to know, but it's all they know how to ask. And so being able to acknowledge what they say, answer it, but not in a 7,000, 22,000. That's not the answer. Being able to answer though, and then ask another question and guide the conversation forward like you would a friend if you were having a conversation over the phone or sitting next to them, showing that you actually care about what they're saying. That's what's most important. So I just wanted to lift that up that, you know, as successful as you are and what we do with our clients are so aligned because being successful in full arch isn't so much like it is in trying to book a hygiene appointment, which is name, rank, and serial number, right? You know, what's your name? What's your phone number? What's your email address? What's your insurance? Copy it down. Great. You're going to end up in the hygiene chair. And what's the lifetime value of the patient? In full arch implant dentistry, it really has very little to do with any of that, even though some of those pieces you need if you want your no-show rate to drop and you want your success rate to increase, making that emotional connection with the patient is critically important, or you're not going to be winning and you're not going to have continued success. All right. Now I'm sounding like I'm lecturing. Anyway, my friend Abhishek, this is the point of the program in the Two Sleuth that everybody plays a little something called What the Sleuth is Going On? 3 rapid fire questions. First thing that comes to mind, are you ready to play?
Yes, I am.
All right, question number 1. What's the worst bad breath you've ever encountered?
Oh boy. One that really took over not just one operatory, but like two or three. It was so bad, but this was also a semi-homeless person that I was treating. So to be fair, but it was really bad.
You know, clinicians always have those kind of stories. For me, it's like perio breath. Thank you, dental industry. The 18 years I've been in it, I can now identify it about 10 rows away on an airplane. Like literally, it's insane. Like, yeah,
I don't. Yeah, I'm not sure if this was like just BO or like right. There was all mixed in, and it was pretty bad. But
had a little bit of everything. Yeah, gotcha. All right, question number 2. If you could change one thing about your smile, what would it be?
my smile. I have a little crowding in my lower teeth, and I think I would fix that. I probably should. It's easy enough for me to get some Invisalign. That's probably the one thing I would say.
Stop it. 23-minute mark. If you're just on the audio, go over to YouTube, 23-minute mark of this episode and look at his smile. It's amazing. So like I'm literally wanting to shame him for even that comment. Although when he smiles, he only shows his maxilla, so you really can't see. So show the camera like your bottom teeth. Let's see that crowding. Everybody wants to see. Be vulnerable. Show the crowding.
Totally, yeah.
Oh, that's so lame. It's so small. Come on, man. Come on. You know, I know if it gets speaks, I'll give you a referral. All right, my friend. All right, question number 3. If you could be the inventor of any dental product and no, you can't choose your own, which one would you choose and why?
Ooh. That's a tough one. I'd probably come up with a really cool robot hygienist right now.
Somebody has an immediate
It
need.
I know. Just kidding. I think a really cool. I know there's some implant robots that are coming out right now, right? Like it's good, but it's not there where it needs to be. I think if I could come out with like a kick-ass implant robot that could pretty much 90% do what clinicians could do, that would be really cool.
All right, fair enough. It's going to get there soon enough, right? So I'm going to play this like 10 years from now when you and I are just like retired and sitting on a beach somewhere. I'll be like, "Do you remember when?" So, who knows? Maybe someday.
This one's for the books. Yep.
That's right. I hear you. All right, my friend. Well, in the last few minutes, I want to respect the time of you and my listening audience. Is there anything I haven't asked you or you want to share with my listening audience before we wrap up here today?
No, honestly, it's been a pleasure. Thank you for having me come on. I really appreciate it. And it's been really fun. I hope to continue our LinkedIn conversations and let's stay connected. I'd love to see how we can collaborate on something in the future too.
I love the idea of collaboration. We definitely are of one mind. And so let's continue that for sure. And Dr. Raj, how do people find you at the Areo Dental Group if they're interested in pursuing more?
Yeah, you can go to www.areodental.com. That's AREO dental.com. I also have an Instagram handle. It's Dr. Dentagram, DR Dentagram. And I have a LinkedIn. I'm pretty active on LinkedIn. It's Dr. Abhishek Nagaraj. So reach out to me anywhere. I'm happy to.
And good content and learning on his LinkedIn for sure. We've got some good banter going back and forth. Thank you so much, Dr. Abhishek. Raj, I'm just going to use because I'm not going to go after the whole thing because it's kind of like my name too, and I don't want to mistake it. So thank you so much, the co-founder of the Areo Dental Group. It's been a pleasure. Thank you, my friend.
It's been a pleasure. Thank you, Greg. Appreciate you, man. Talk to you soon.
If you need help with converting lead calls into consultations, closing consults into more full arch cases, or creating a more strategic marketing message and branding for your practice or group, follow me for more tips or reach out to G&A Consult for a discovery call today.